Hare Krishna. Today we will discuss how many scans, that is ultrasonography, we should do in 9 months pregnancy. Patient always asks the question, Madam, whether so many sonographies are safe in pregnancy or not. So we have to understand that ultrasonography is absolutely safe in pregnancy and it doesn't cause any untoward effect to the fetus. Now the first scan we do at the 2 months, that is 6 to 8 weeks. What is the advantage of the first scan or so early scan? It helps us to distinguish between the intrauterine pregnancy and extrauterine pregnancy. Extrauterine pregnancy means sometimes the pregnancy doesn't happen inside the womb but it happens inside the tube, and that is not safe for the mother, so we have to terminate that pregnancy. Earlier we detect it, we can do the management with the medical management, that is with the injections, and we will not have to do the surgery on the patients. But if it is delayed, we have to do the surgery for ectopic pregnancy. Hence, the first scan is recommended between 6 to 8 weeks. It also gives us the additional advantage of predicting the date of delivery. Now second scan is done between 11 to 13 weeks. That is called as NT scan. NT is a sonographic parameter which has to be less than 3 millimeters. If it is more than 3 millimeters, it raises the suspicion of Down syndrome, that is trisomy 21. Similarly, we also detect presence of nasal bone in NT scan. Absent nasal bone is a very strong predictor of chromosomal anomalies and the further investigations are needed in this patient. Coming to the third scan. Third most important scan is anomaly scan, which we do between 19 to 21 weeks. In this anomaly scan, we actually detect all the possible physical abnormalities present in the baby. Coming to the fourth scan is supposed to be done between 28 to 32 weeks. This scan is not compulsory, it is optional, but it is better to do the scan. It will help you to find out whether the fetus is growing properly, whether the amount of liquor is proper or not. The final and last scan is done between 36 to 38 weeks, and it again helps us to find out whether the baby growth is proper, baby weight is proper, and the amount of liquor around the baby is proper. So coming to the color Doppler. Patient usually asks the question that, Madam, can we do a color Doppler? Color Doppler is not recommended for all the patients. It is required for those patients who have some growth retardation or hypertension or diabetes or any other high-risk pregnancy. Now one more question patient asks is about the 3D and 4D scans. We have to understand that anomalies are best identified in 2D. So anomaly scan has to be compulsorily done in the 2D, but 3D and 4D will help them to see certain defects like cleft lip. It is only for the patient satisfaction, happiness, but basically anomalies are best seen in 2D.